I decided to be an otolaryngologist about midway through medical school. I liked the medical decision making and the problem solving as well as the surgical aspect of otolaryngology. And over time, I narrowed my niche within otolaryngology to nose and sinus surgery because I particularly enjoyed doing that and teaching that. And I typically treat patients with nose and sinus disorders. So that's a smaller niche within ear, nose, and throat or otolaryngology. So I treat patients with disorders like nasal polyps, nasal obstruction, deviated septum, recurring sinus infections or chronic sinus infections. I have been here for 26 years, so I also have a large referral network of community otolaryngologists that refer in complicated sinus patients for management. I also see a lot of patients that complain of sinus pain, and frankly, the majority of those patients have migraines. So I spend a fair amount of time with those patients, but probably they would be better served working with their primary care physician or seeing a neurologist because I don't do long-term care of patients with migraine. It's been an absolute privilege working at the University of Michigan for 26 years, and part of that is the local team within otolaryngology. But I think a huge part of it is the confidence I have in referring patients to see the other specialists within the University of Michigan. I know from watching what goes on in the state of Michigan that the quality of care provided across the board at our institution is not only top quality, but really very safe medical care.